So welcome to our show today. It's nice to have a man because we're going to talk a little bit about men and testosterone and andropause. So before we get started, why don't you introduce yourself?
Well, thank you for having me. I appreciate it. My name is Ben Blanchard. I am a pharmacist at MedQuest. I've been a pharmacist for 10 years in multiple settings. This is a privilege to be with MedQuest and with the innovative medicines that we provide.
Great. So I'm going to start out by saying women are not the only ones who experience a change of life. Is that what you're going to talk to us about today?
Yes, the emphasis for all time, it seems, has been on menopause and women, and they're the only ones that go through decline in hormone production and the difficulties and side effects that they struggle with that. In fact, men also go through this hormone decline or a hormone decline, specifically testosterone. When we talk about the side effects or what they might experience, both short-term and long-term.
What is andropause? Why don't you talk to us about what is it?
So andropause is the male version of menopause. As we know, women, as they age, they have a decline in hormone production, estrogen and progesterone. Men go through a similar process, termed andropause, and their testosterone levels decrease. This generally starts around the age of 30, and each year our testosterone levels decrease by 1 to 2%. In addition to this, our body produces a protein called the sex hormone binding globulin that decreases the free testosterone in our bodies. So it's a twofold decrease. Again, this isn't something that just happens overnight. This isn't something you're just going to wake up and your testosterone levels are going to, be on the floor. It's a gradual decrease, and the symptoms and the risks that go along with that are also gradual.
So it's very different from women who suddenly go through menopause and they just feel like crap.
Yes.
Yeah. So for men, it's
it'd be a slower process. Yeah, you can experience anything from fatigue, nervousness, depression, irritability. It could be sleep disturbances, a decrease in sex drive or libido. That's probably the focus of testosterone in men. Is with men that is generally the focus is that libido or sex drive. But again, men can also experience hot flashes just like women when it comes to menopause. But I think the things that get left out are that fatigue and depression, sleep disturbances, which affect mood, which affect our overall general well-being and quality of life. And we search for answers, and it's probably right in front of us, but it's the one thing that we don't look at, and maybe our primary care physician might not look at.
Yeah, it just seems like this is not very well known. It seems like it's avoided. Is it still the stigma of it being abused by athletes that more physicians don't, recommend it?
Yeah, I think so. I think there's a big stigma behind it. Athletes, men, generally associated with sports enhancement, performance enhancement, that type of thing. That's not what we're talking about here. We're talking about simply providing a quality of life and getting you back to feeling normal again, feeling, for lack of a better word, maybe in your prime again, if you want to talk about that. It is a stigma behind it. Men, we want to show strength. We're all about strength and look what we can do type thing. So we don't want to talk about it. We're not good at talking about our weaknesses. We're not good at being vulnerable. And I think if we can make it a discussion and make men understand that this is a normal thing, that in fact every man is going through this process, that they might be more comfortable to talk to their physician, to learn more about it, and not be so hesitant to approach a healthcare professional.
So I know that in women, when their hormones decline and they go through menopause, they're at greater risk for heart disease, for osteoporosis, for memory loss, especially when replacing it with the more natural forms of hormones. Does testosterone essentially do the same thing that estrogen does for women?
It does. Studies have shown that testosterone levels in men are directly related to cardiovascular risk. So if we can get our testosterone levels to optimal level, we can reduce cardiovascular risk. We can increase bone mass, so try to avoid osteoporosis. and then also improve cognitive impairment, so memory loss. When your wife asks you to do things and you forget, you can maybe help us remember and not get in trouble.
Right.
Yeah.
So I guess the key to feeling great is make sure that if the woman is seeing a doctor for hormone replacement therapy, that their spouse or significant other should probably do the same.
Absolutely. I think it should be a conversation with both of them. Like say short term, we're talking about mood stability, better relationship, better communication, because you're not irritable, you're not depressed, you're sleeping better. Your muscle mass, your strength, how you feel when you wake up in the morning can be improved. In addition to those long-term effects, your cardiovascular risk is decreased, you have better bone mass, and cognitive impairment or your memory is better.
Great. All right. Well, I'm not sure I have any more questions. Thanks so much for being here with us today.
I appreciate the opportunity. Thank you.